So Softwave is a world-leading treatment that revitalizes the skin through precise stimulation to produce new collagen. It does this through its patented synchronous ultrasound parallel beam technology. This is a similar technology that was used in previous devices, such as ultherapy. Ultherapy delivered ultrasound energy to the skin and deeper tissues to generate collagen. But the issue that there was with ultherapy was that the energy was released perpendicular to the skin, so it spread down into the deeper layers. There was a chance of obviously damaging deeper structures such as nerves, as well as depletion of fat. Where Softwave's ultrasound technology is different is in the parallel beam technology. The energy is actually released parallel to the skin, so there's no deeper penetration, and the treatment is completely safe, so you don't need to worry about any possibility of nerve injury or even fat loss after the procedure. So Softwave has been proven in clinical literature now to be more effective than ultherapy. Ultherapy goes down to 4 millimeters, but we know that that has certain safety concerns. We know that Softwave is much more precise in the area where you actually need to stimulate collagen. That's in the subdermis, so the lower layers of the skin. That depth is at 1.5 millimeters. With Softwave, you can increase the size of the core that is delivered. So if you even need to go a little bit deeper, you can with Softwave at higher powers. And it's this precise technology that delivers more superior and safer results. Softwave is a new world-leading treatment to revitalize the skin through precise stimulation of production of new collagen. Softwave's synchronous ultrasound parallel beam technology is clinically proven to lift the eyebrow underneath the chin, neck, and reduce fine lines and wrinkles. It's a treatment that requires topical anesthesia for about an hour, and the treatment for a full face and neck takes about an hour too. There is an option to have injectable anesthesia, but this is only for specific areas and specific indications, which we will, after a thorough consultation, will tell you whether you actually need this. Softwave is FDA cleared for a number of different indications, which is unique for a device. It's cleared for lifting of the eyebrow. I commonly see in my patients up to 4 millimeters of lift of the brow. So if you're suffering with lower lids, this is a very quick treatment you can have done. For brow lifting, I always recommend 1 to 2 treatments, and then once every kind of 15 to 18 months to maintain. It's also cleared for lifting lax submental tissue. So this is the tissue that sits underneath the neck area. There are some fantastic examples of before and after some clinical studies that we've performed that you can see some great tightening within this region. As it's non-surgical, I would normally say that this is the most powerful non-surgical options for that area. It can also lift neck tissue, so you can also get a little bit of lift in the neck to give you that better jawline as well. And the final FDA indication is the reduction of fine lines and wrinkles. Because it releases the energy at 1.5 millimeters, it helps with all these fine lines and wrinkles, so the skin quality looks better too. So normally a clinical team advise patients that you will see an immediate skin tightening effect. This is a process called coagulation. This is a sign that the treatment has been performed at the adequate parameters and that it's going to work. This is a collagen stimulating treatment, so you will start to see results from about 4 weeks, but most patients start seeing an effect at about 8 weeks, and then that continues up to 6 months. Even in some patients, I have seen improvement even up to a year post-treatment as well. Generally, in terms of the number of treatments that people require, it always ranges between 1 to 2, depending on severity. So Softwave is performed by all clinicians here at DRMEDISPA as well as our aesthetic therapists. Some of the areas that may need a physician to be treated are individuals that may have a lot of lax skin around the lid area and may require higher power. Just remember, higher power does not always equate to a better result. In terms of your assessment, we assess whether your tissues will need that higher power. And based on that, we make a treatment plan for you, and then we allocate the right clinician for you. They both use ultrasound technology. So here at DRMEDISPA, we have previously used Ultherapy historically for nearly a decade. But upon the release of Softwave around a year ago, Softwave is now seen as the gold standard for non-surgical lifting, tightening and rejuvenation of the skin. It's also a lot safer than previous Ultherapy treatments. We've always been able to perform Ultherapy in a safe and effective manner, but there are always patient variables. Because of the parallel beam technology with Softwave, where there's accurate placement of energy, that risk is negated. So even if it was a small risk with Ultherapy in terms of damaging deeper structures such as nerve injury as well as fat depletion, this we can be completely confident with Softwave that this doesn't occur. And this has been proven in clinical studies and trials that here at DRMEDISPA we have been a part of. So HIFU is high frequency ultrasound. Unfortunately, with most HIFU devices, the ultrasound technology is not so precise. It's also released perpendicular to the skin, so there's a non-focused delivery. You've got a danger of damaging deeper structures, and HIFU is inferior to things like Ultherapy, and it's a lot more low powered. So it's really there for somebody that only really wants a very subtle result. If you want more of a long-lasting result, then that's where Softwave can deliver both the high power, but also the precision and safety. And that's why it is now seen as the gold standard for non-surgical lifting and tightening. Softwave can be used on the full face and neck. One of the areas that the DRMEDISPA clinical team have designed a specific protocol for is for the eye area, and you'll be able to see some examples in terms of before and afters. You can get up to 4 millimeters of eye lift after 1 to 2 treatments around that area. So Softwave is ultrasound precise technology that we talked about. Thermage is radiofrequency technology. Radiofrequency in its nature, it is great for stimulating collagen. However, there's a maximum limit of energy that you can deliver with radiofrequency, and it heats the skin from the outside and it goes down to the target areas. Therefore, you can't deliver as much energy to the lower parts of the skin that we want to generate collagen with. So although Thermage used to be a gold standard many years ago, ultrasound technology allows you to develop collagen from within rather than stimulating from outside in. There's also no downtime with Softwave as there may be with Thermage in terms of the heat that it gives. There's no downtime with Softwave. You can go back to daily activities easily. You may feel a little bit hot. There'll be very mild swelling. But I've had patients that have come to the clinic and then literally gone out for dinner in the same day with no downtime whatsoever. So it's an extremely safe treatment, minimal downtime. There is some pain during the process, and this is the reason why we apply topical anesthesia prior, but we've never seen a patient that hasn't been able to handle it. So here at DRMEDISPA, we always like combination procedures. I always recommend doing Softwave for facial tightening and lifting first. It's great for tightening the skin and lifting. If you've got textural change, such as pigmentation and a little bits of lax skin, then you can then do your Softwave, let that settle down and get some more collagen, and then mix that with other energy-based devices such as the CO2 laser from Alma Hybrid or from Morpheus 8. But I feel that if you're looking to lift this area, lift the face and lift the eyebrows, then Softwave is your #1 treatment that you would start with as a base. A lot of patients just use that, and then over the years, to correct other skin textural issues, they may entertain different treatments. So it's designed to be combined, and if you combine different treatments, of course you're going to get a better result. But if you come to us and have an in-depth consultation, we'll be able to make a nice plan for you in terms of when to do which treatment. So the treatment course for Softwave is quite simple. We do an in-clinic assessment in your consultation. For full face and neck, it's most likely that you will only need one treatment. If you have a specific area that you need to treat, for example around the eye area, DRMEDISPA, we have a specific protocol, which is a 2-session protocol to lift the eye area. That is normally the area that needs 2 treatments, but the face and the neck, for majority of patients, you just need 1 treatment. You'll start seeing results at about 8 weeks, maximum results at 6 months, and even at 12 months as well. In terms of retreatment, I like to retreat patients anywhere between 15 to 24 months after the first procedure. We do like to perform a whole assessment, so during the next 2 years after your Softwave treatment, we may replace volume in the face, we may resurface the skin, we may help with the texture, and that can be done with different treatments as well. But it's a very simple treatment that can be performed with minimal downtime in little under an hour, and that doesn't really take any time from your day or any need for recovery. Softwave is extremely effective. If you read one of the clinical studies looking at patients that were treated with 1 treatment of Softwave, 88% of patients had a significant improvement in fine lines, wrinkles, and lifting of the face. There was also high patient satisfaction with the treatment as well. There is some pain involved with Softwave because it is a very powerful treatment. But here at DRMEDISPA, we have some good tactics to actually help with pain. So we numb the area for a good hour prior to the procedure. There's also contact cooling in the handpiece that we can turn up that quickly reduces the heat that is experienced from the procedure. Also, we have the ability to inject anesthesia for very sensitive areas, as well as some analgesia in terms of a form of a gas that can be used during the procedure as well. So there are many different strategies that can make the procedure a lot more comfortable. Majority of patients are absolutely fine just with topical anesthetic, but like I said, we have a number of different strategies to help you out.